Good morning. This morning I'm going to talk about the Equine Disease Communication Center, which actually was an idea that occurred when my hospital about 9 years ago was closed due to a herpes virus, a neurologic herpes virus outbreak. It became apparent that though we could master the medicine, the communications with the horse community was the toughest job. So then in 2010, the USDA met with the American Horse Council, and they had a workshop looking at what the community, what the industry could do to help with stopping diseases. And so they came up with the idea of a national equine health plan, something that prevent, detect, and respond to diseases, try to minimize the impact of those diseases, try to promote trade and make sure commerce didn't stop because of a disease, and really, very important, is the education of the equine community about disease and prevention. The last was promoting research, which we still have a lot to do in this area as far as infectious disease. So the reason for this is because there is increased risk of diseases in horses, and there's several reasons. One is some very infectious, highly infectious diseases that horses have, the risk of foreign diseases coming to this country, which could have a huge impact, detrimental impact. Horse movement, horses move or are transported more than any other livestock in the U.S. And not only that, but they are mixed. In the husbandry, when they go to horse shows, race tracks, wherever, the mixing and the way the husbandry and the environment puts the horse at risk many times for infectious disease. And then there are vectors, which we have to consider. So in the last decade, there's been several types of diseases, outbreaks that have caused a detriment to the industry. In 2005, vesicular stomatitis tied up transportation and closed quarantine transportation from several states, stopping trade, stopping transport. Contagious equine metritis in 2008 and 2009 certainly did the same thing. And then more and more, we've seen the equine herpes virus, particularly the neurogenic, or the one that causes the neurologic disease. And the ones back at that time were the racetracks in Maryland, which I was familiar with, our hospital, which was affected, the Finley School in Ohio. And then in 2011, at the National Cutting Horse Association show, or the cutting, they had a major outbreak. They had about 2,000 horses potentially exposed. Premises were exposed, and what happened was it was a Friday night, and so when this happened, there was minimal communication. Horses were leaving, and so it actually affected up to 19 states. 13 states had confirmed cases at that time. California alone, out of 540 events that year, had to shut down or close 148 because of the impact of this disease. So the AEP took up a task force at that time in the fall of 2011, and their recommendation was, one, to establish an equine disease communication, a place similar to the CDC, where human diseases are looked at and the information broadcast. A triage system so that the information coming in was reliable. The rumors that spread after the cutting horse show was detrimental. Even in Virginia, which was far-fetched from that, I had people asking me if the borders were closed. So we need a way to confirm that the information being sent out is real, and we wanted to do it in real time. And then a website, which could be the main source of communication, and that's what we've done, so that people could go to that, get real-time information that's reliable. So our definition was a communication system which informs and educates constituents in the horse industry about diseases in order to minimize the effect on the horse health and the horse-related economy. And so we've tried to follow that mission. What we do is first is ensure that the information about an outbreak is accurate. We work with state health officials to make sure that those reportable diseases, that it's confirmed, there's a laboratory positive test. We use the website, email, Facebook, and Twitter to send out the alert to tell people specifically there's an alert on the website that's telling you what's happening right now about a new outbreak. There's a call center established by USEF. They've been kind enough to volunteer this, and that's going to start in about 4 days, where it'll be open with a phone number and people can call in to get information, or people can actually make a report. So we do work closely with state animal health officials. Many of them are sending this information to us now before it hits the media. That allows us to get it up, and we use the website to do that. It really is similar to the AAP on-call program, where you've got to confirm facts right away, have an informed informant, somebody that's going to give you the right information to an audience that's very concerned, and if you don't say something about it, then the rumors spread about what's happened. Bailey McCollum is our communication manager. This is a position that the EDC supports. The office is at the AAP. This person communicates the coordination of the communication. It helps to seek the information, goes to websites every day, looks for outbreaks that might be occurring, posts alert on the website, and then the other real important job is an educational feature where we want to have information on the website that helps educate the industry, the horse owner, even the veterinarian who has a background in medical disease, but where they can get updates about this. So the website's very simple. There's resources. We have an introductory page, an outbreak page. We have a page on diseases, a page on vaccination, which is really AAP vaccination guidelines. We have the state veterinary, or the biosecurity page, which gives you information, videos, and so on about biosecurity. The state veterinarian information page, so you know where to go to find what's happening in that state, USDA information, and then a sponsor page, which of course is for us is very important. So this is the main page. On the right side of the column, there's information about how you can sponsor. There's information about going to Facebook and Twitter, and you can sign up to get the email blast if you want to have that whenever that happens. The alert page is very simple. We put in a date, the disease, where it is by either city, county, and state, and then the status. Is it a quarantine? Is it information? Is there investigation going on? Something to say what's happened. And then a text, which often is coming from the state veterinarian, is what has happened and what is going on now. Is there a quarantine? How many horses? What are we going to do? Are we going to quarantine? Are we going to move any horses? So we try to have just the facts. This is not an outlet to describe the disease at this stage. It's just to say, here's what's happening now. Importantly is getting the first information is getting the feedback when the quarantine's over, so everybody knows, okay, everything's done. So we do that as well. So we've had 205 alerts since April 2015. That's alerted for 11 diseases, 56,000 views. That's since February of this year, and 20,000 unique IPs, people coming to that. 66% have gone to the alert page. We've had the herpes neurologic forum in 17 states. 5 of those states had racetrack. And then again, the call center is going to open July 1. The disease information page, this has got lists of the infectious diseases, and under each one there's a link to information about that disease. That can come from various sources. We are going to be putting up a horse owner brief description about the disease, an easy way to look at it and digest it. The biosecurity page has, as I said, areas of biosecurity. It's information about how to. It's videos about how to. It's what you need to worry about. And importantly, it's how you can assess your event, your racetrack, your trail ride for risks for biosecurity. So this is one of the most important parts of our communication center. It's a set of preventative measures designed to reduce the risk of introduction and transmission of infectious disease. And that's broad category, but the main things I think that we need to be instilling in people now is you need a biosecurity plan at your home stable, at the horse show, at the racetrack, wherever it is. You should do a risk assessment, and we'll be having information about how that can happen. So what's your risk when you're transporting somewhere, you have an event, what's the risk and how can you prepare for that? Knowing about what sanitation to use, what works, what doesn't work. Have a plan for isolation, particularly if you're at a horse show event, especially some type of large area, is to know that if I've got a problem, I can immediately isolate either locally or if I have to move the horse. And then what quarantine means. What happens when we do that? And again, most of those are done by the state veterinarian for reportable diseases, but it's also possible for a show or someone to institute that. Education is key. If the groom doesn't know about biosecurity, it's going to fail. Same with the event manager. You need to know about it and be educated. The state animal health officials page is a map, and you can click on the map. In this case, I've clicked on Kentucky, so it brings up the state veterinarian, location, email, telephone numbers. So anybody can go in and find out where to start to look for that information. EDC is industry supported. This has all been supported by donations. We have 45 sponsors now, I'm pleased to say. It was initiated by the American Horse Council. Our goal is to get everybody involved, large and small donations. It's important that everyone knows the USDA has supported this now for 2 years for $75,000. That's huge. It's allowed us to get started with this, and we're hoping that they will continue that on into in the coming years. So it is a tax-free donation to support this. It goes to the AEP Foundation directly for use by the EDCC. The sponsors are listed, and there's a link to that name to their website if they desire. And I do need to personally thank the Jockey Club. They're our sponsor. And again, huge help to get this thing going and to keep it going. So what do we know for sure? We're always going to be dealing with these outbreaks, and so it's important that we have a way to communicate. I hope that you will embrace this. If you want to get a hold of Bailey or myself, the email address at the bottom goes to both of us. The website is in your booklet, which shows the website you can go to and look at this in your own time. So I appreciate it. If there's time, I'm happy to answer any questions. No questions. Thank you.